Have you ever felt like your health is just a bunch of separate pieces and no one's looking at the whole puzzle? You see one doctor for your gut, another for your hormones, and it feels like they're not even on the same planet, let alone talking to each other. Well, in an absolutely game-changing discussion on the Huberman Lab podcast, Harvard-trained physician Dr. Sara Gottfried explained exactly why this siloed approach is failing so many women. So we've broken down her science into a simple, actionable playbook so you can become the architect of your own health starting right now. This right here is the heart of the problem Dr. Gottfried points out. You go to a gastroenterologist for constipation, a rheumatologist for an autoimmune issue, an endocrinologist for your thyroid, but they almost never communicate. And this fragmented approach, it's not just inefficient, it can lead to years of frustration and totally missed opportunities. Because, as we're about to see, all of these things that seem separate are actually deeply, deeply connected. And Dr. Gottfried just says it perfectly. She argues that even though science gets that our bodies are interconnected systems, which she calls a network effect, the day-to-day practice of medicine just hasn't caught up. This quote really frames the need for a completely new way of thinking, one that sees the body as a single, unified system. Okay, so here's our roadmap for today. First, we're going to pinpoint the body's true master controller. Then we'll dive deep into that crucial gut hormone connection and figure out exactly what to test. After that, we'll get into the most powerful levers you can pull to take back control, navigate the super complex topics of contraceptives and menopause, and finally, build your own personal health blueprint. All right, section 1, the master controller. If we want to break free from those health silos, we first have to figure out what system is actually running the show. And here's a spoiler alert. It's a whole lot more than just that classic stress axis you might have heard about. Dr. Gottfried calls it the PINE system. That's psycho, immuno, neuro, endocrine. Now, I know it's a mouthful, but it's a revolutionary way to look at your health. It basically means your psychology, your immune system, your nervous system, and your hormones are all in this constant, dynamic conversation. This is exactly why stress isn't just in your head. It has a direct physical impact on everything from your immune cells to your hormone levels.
So what's the control panel for this PINE system? Well, Dr. Gottfried expands that traditional HPA stress axis to paint a much more complete picture. Her version includes the gonads, your ovaries, the thyroid, and, crucially, the gut. Her whole point is that you absolutely cannot understand your hormonal health without looking at the thyroid, which is the master of your metabolism, and the gut, which, as we're about to find out, plays a shocking role in regulating your key female hormone.
And that leads us right into one of the most incredible ideas in modern medicine, the direct link between what's happening in your gut and what's happening with your hormones. Turns out, your microbiome isn't just there for digestion. It's basically a key endocrine organ itself, meaning it actually produces and regulates hormones. So, inside your microbiome, there's this specialized crew of bacteria that scientists like Martin Blaser have named the estrobolome. You can think of them as your own personal estrogen managers. This very specific group of gut bugs has one main job: to process and regulate your body's estrogen. Just think about that. The health of your gut directly controls the level of one of the most important female hormones. It's staggering. So here's how things can go wrong. Certain gut bacteria produce an enzyme called beta-glucuronidase. When the levels of this enzyme get too high, instead of your body getting rid of estrogen after it's been used, this enzyme grabs it, recycles it, and sends it right back into your system. Dr. Gottfried's analogy here is just perfect. It's like bad karma. It just keeps coming back around. And this whole process can lead to estrogen dominance and issues like fibroids, breast pain, and even a higher risk for some cancers. So what's a huge flashing red light that this system is off? Constipation. Dr. Gottfried sees it in up to 80% of her female patients, and her definition is simple: anything less than one complete evacuation every single morning. This isn't just some minor inconvenience. It's a critical red flag for much deeper issues in that PINE system, from a struggling thyroid to high stress. And part of the reason women are more susceptible is anatomical. Get this: the female gut is about 10 feet longer than the male gut, which naturally increases transit time. All right, so we've covered the theory. But how do you get a clear picture of what's actually going on inside your own body? Well, that is where strategic testing comes in. It's all about getting the right data so you can make the right decisions. Okay, this chart is basically your cheat sheet for smart testing. Dr. Gottfried really emphasizes that how and when you test is everything. So notice she prefers saliva for cortisol because it measures the free, active form of the hormone. And for your main sex hormones, estrogen, progesterone, and testosterone, she recommends a dried urine test around day 21 or 22 of your cycle.
Now, here's the key reason. A blood test just gives you a single snapshot in time, but a urine test shows you the metabolites. It shows you how your body is actually using and breaking down those hormones. It's a much, much more complete picture.
So once you have your data, it is time for action. Dr. Gottfried focuses on the two most powerful levers that we can pull to shift our hormonal health: what we eat and how we manage stress. 57. What in the world does this number have to do with nutrition? Well, Dr. Gottfried tells this incredible story of a physicist with an autoimmune disease who became completely obsessed with fixing his microbiome. And what was his solution? A daily smoothie packed with 57 different fruits and vegetables. The result was just astonishing. His autoimmune disease went into remission. It's just such a powerful example of food as medicine. Now let's talk exercise. The common wisdom is always more cardio is better, right? Well, that's not the whole story. For optimal hormonal health, Dr. Gottfried actually recommends a ratio of about 2/3 resistance training to 1/3 cardio. And the reason is pretty simple. Chronic cardio, like long-distance running every single day, can chronically jack up your stress hormone, cortisol, and that can throw your entire hormonal system out of whack. And speaking of cortisol, here are some really solid science-backed tools to help you manage it. Supplements like phosphatidylserine and rhodiola have been shown to be pretty effective, but you really don't want to overlook the simple behavioral tools. A study they talked about on the podcast found that just 5 minutes of cyclic sighing breath work each day significantly improved mood and lowered stress markers. But the ultimate key, as Dr. Gottfried points out, is lowering your perceived stress, your body's internal response to everything that's happening around you. Let's shift gears and talk about two of the most significant and, frankly, often misunderstood crossroads in a woman's life. These are moments where the choices we make can have really profound long-term consequences for our health. The oral contraceptive pill, it's a classic double-edged sword. So on the one hand, 5 years of use can slash your risk of ovarian cancer by 50%. That's huge. But the risks are also significant, and they're not talked about nearly enough. It can deplete key nutrients, raise inflammation, and it increases a protein that basically acts like a sponge, just soaking up all of your free testosterone. And here's the really concerning part. That effect on testosterone might not be fully reversible, even after you stop taking the pill. -20%. This might be the single most shocking statistic that Dr. Gottfried shares. It represents the potential shrinkage of the clitoris after long-term use of the oral contraceptive pill. I mean, that is a profound physiological change that is almost never discussed with patients, and it just highlights the critical need for truly informed consent. Okay, now let's talk about the transition to menopause. There's this groundbreaking research from Dr. Lisa Moscone at Cornell that shows perimenopause isn't just about your ovaries. It is a major event for the female brain. As estrogen starts to decline, usually starting around age 40, the brain's ability to use glucose for energy drops by about 20%. This completely reframes symptoms like hot flashes. They're not just some nuisance. They're actually outward signs of this significant metabolic shift that's happening in your brain. Okay, we've covered the system, the problems, and the interventions. So now let's pull it all together into a simple, powerful blueprint. Dr. Gottfried argues there are two non-negotiable tests that everyone, and she means men and women, should get to really understand their long-term health risks. The first one is a coronary artery calcium score, or a CAC score. It's a simple CT scan of your chest. It usually costs a few $100s, and it directly measures the amount of calcified plaque in your coronary arteries. Getting this scan by age 45 gives you an incredible look at your actual risk for heart disease, the #1 killer, and it lets you intervene decades before there's a potential crisis. The second one isn't a medical scan, but it is every bit as critical. Know Your Adverse Childhood Experiences, or ACE score. It's a questionnaire that quantifies early life trauma, and the data is just undeniable now. A high ACE score maps directly to a higher risk of nearly every major chronic disease in middle age. Understanding your score helps you connect the dots between past psychological stress and your current physical health, and that empowers you to address the real root causes. Wow. We have covered a huge amount of ground, from the interconnected PNA system to specific biomarkers and actionable tools. And look, knowledge is powerful, but it's action that actually creates change. So the final question is really for you. Looking at everything we've just talked about, what is the one step, the one action you will take starting today to become the true architect of your own health?